Hi guys, welcome back to my YouTube channel. Today I'm going to discuss about the most important topic in pharmacology, which is usually asked as a 9 mark and also as a short note 4 mark question in final year examination of PDS. So that is insulin preparation. Here I have involved only some subunits of this topic which are usually required for to be written in examination point of view. If you focus on these topics and the matter is quite briefly explained into a limited extent, so if you write only this amount is sufficient. Insulins are classified on the basis of its source as bovine, porcine, and human insulin. Bovine is obtained from cattle, whereas porcine is obtained from pig, and the third one is human insulin. The second classification is based on the duration of action. It is classified into three types, that is short acting, intermediate, and long acting. Now we'll talk about how these preparations are usually given subcutaneously to patients, but intravenous administration is only in case of regular insulin. These insulins, when given orally, they are destroyed. The doses, the units, the doses of insulins are expressed in units of insulin, and they are calculated in patients by monitoring by two types of monitoration. The first one is by blood glucose level, and second one is by glycosylated hemoglobin levels. Now we'll talk about the disadvantages of why conventional preparations are used. Now they are allergic. These preparations like porcine, bovine, all are allergic to the patients, and they are because they were obtained from animal source, they contain some sort of impurities. Because of these reasons, they used to cause some kind of allergic reactions to patients. And the second one is that these insulins were not at all stable when given to patients. And in place of these insulins, a replacement type of insulin has came into consideration. Those insulins were known as highly purified insulins. Mostly porcine insulins, by more developed purification techniques. These purification techniques were like gel filtration, ion exchange, chromatography. By these two mechanisms, these porcine insulins were purified, and they had contaminating protein content was so negligible, and they were also available as long and short acting forms. Now we'll talk about human insulins. These human insulins were produced by DNA recombinant technology. Recombinant DNA technology. They are available as regular lante, ultra lante preparations, but these insulins were quite expensive and not at all affordable by poor people, but they had more advantages over others as they were highly absorbed and only less dose was required to be given in patients. And advantages of these insulins were like they were less antigenic, they were more stable, less chances of resistance was seen in patients, and they were not at all allergic as in case we have seen in conventional preparations. And lipodystrophy, as you can see in this diagram, it can cause inadequate adipocyte capacity, like in case of patients there may be fat accumulation or as fat degeneration, uninvolved, uncontrolled kind of fat metabolism is seen in case of lipodystrophy. And while injecting lipodystrophy at the site of infection is seen, and Low lipodystrophy was seen in patients, sorry, in case of these insulin preparations, insulin administration. Now, insulin analogs with favorable pharmacokinetic properties have been developed. While preparing a duck, maintaining its pharmacokinetics was quite important, is obviously important. Now, absorbed in 3 times faster than human insulins. These drugs, sorry, these insulins like porcine and bovine, they were absorbed 3 times faster than human insulins, and they can be given subcutaneously and should be given 10 to 15 minutes before the intake of food. And less chances of hypoglycemia is seen in patients, and they have better blood glucose control. Now we can see some insulin delivery devices, like how these insulins were administered by patients. Like they can be self administered, or they can be administered by any like hospitable. They can be administered by doctors or healthcare supervisors too. And they like portable pen injectors and insulin pumps. These were available in, like, they were convenient in both forms. In patients with severe diabetics, they can be taken by the patient itself, or if in case, they can be administered by the healthcare supervisors too. Thank you today. This was the end of this topic. Thank you for your cooperation, and